Hi, my name is BURKHARTngt and I'll be doing my NG-tube video. So we're going to start. Alright, knock knock, nurse entering. Hello, Mr. Templeton. My name is BURKHARTngt. I'll be your nurse today. I have some supplies here. But before we begin anything, I'm just going to verify that you are who your orders say you are. Let's see. Oh, yeah. And can you state your name and date of birth for me, please? Okay, perfect. So you are Michael. Mr. Michael, can I call you Mike? Okay, excellent, yes. Alright, so today what we're going to be doing is we're going to be giving you an NG tube. An NG tube stands for a nasogastric tube. And what that is, it's basically a tube that goes from your nose all the way down to your stomach. And today we're going to be suctioning out your stomach contents today. And that was ordered by your doctor because for the past 3 days you've been vomiting and you have a small bowel obstruction. So to prepare you for any procedure, we're going to have to help that bowel obstruction. We're going to make sure that your stomach is all clear and suction free, so that's why we're putting the NG tube to suction your stomach, and also gives you a bit of a rest so you don't have to keep on vomiting. Alright, so before we begin though, do you still consent to this procedure? Yes you do? Okay, excellent. And I'm going to do a quick assessment on you before the procedure, and then I'll explain the procedure to you detailed, and we'll ask you if you have any questions on that, okay? Alright, so first we're going to start by listening to any bowel sounds that you have. I'm going to clean off my stethoscope here. Actually, I'm going to visualize, where's my trash can? I'm going to get my trash can over here. Okay. Clean off the end of my stethoscope. Okay. So normally with a bowel obstruction we would listen to each quadrant for 1 minute, but for the sake of this video I'm just going to listen to each one for a couple of seconds and simulate the minute. Okay, Mr. Templeton, so I can definitely tell you have some decreased bowel sounds. So when was your last BM? Okay, and have you been passing any flatus recently? Alright, and I know you've been throwing up for the past 3 days, but how's your nausea as of right now? It's not too bad? Okay. Do you feel like you're going to vomit? No? Okay, well that's a good sign. Okay, so now I'm going to just look at your nasal passageway. You don't have any deviated septum. Everything looks okay. I'm going to ask you a couple questions about your nose that will affect the procedure. Have you had any history of nosebleeds at all? Okay, what about seasonal allergies? None with that? No nosebleeds with those? Okay. Have you ever had any esophageal varices? You don't think so? Well, have you had any liver problems at all, or any history of liver issues? No? Okay. And have you had any skull trauma or any head fractures? No? Okay, perfect. And can you take your hand, please, and cover up your right nostril and breathe in and out for me, please? Okay, and can you do that again? Cover up your left nostril, breathe in and out for me. Okay. It sounded like your right nostril here was much clearer than your left. Am I correct with that? Yes. Okay, so we're going to be entering the nasogastric tube through this right nostril. So now I'm going to explain the procedure. So I brought all the materials into your room. So what we have is we have our nasogastric tube, and I'm going to put lube on it, and I'm going to insert it in your nose. I'm going to insert it in for 4 inches, and then it will make you gag, and I'll pull it out about 1 inch, let you get your bearings, and I'm going to ask you to tilt your head forward, and I have a cup of water for you, and you're going to take your cup of water, and you're going to take a gulp or sip, and I'm going to push it in. I'm going to take another sip, and I'm going to push it in, and you take another sip, and I'm going to push it in to the length that I have already pre-measured out. And it's all the way in where we think it should be, where I'm going to pull back a little bit on a syringe. We're going to make sure that we get stomach contents out. I'll check the pH on that. And once we have that all set, I'll hook you up to intermittent suction. Do you have any questions on that at all? No? Okay, alright. I see that you don't have a pillow already, so that's good. You decided not to have a pillow today. It's more comfortable? Okay. So that's good. We have your head back. I'm going to make sure you sit up in bed. Okay, perfect. There we go. Alright, so I'm going to pull my supplies around here. I'm going to take this trash can, pull it over by me. Take this, pull this up to my height. I'm also going to pull your bed up, and I'm going to position you in high Fowler's position. There we go. I'm going to pull you right on up. Just comfortable length where I'm like working with you. Okay, perfect. So I have our washcloth here. I have this in its sterile package over here. We have your glass of water with your straw right here. We have our little pH paper. I'm going to pull one out. We're going to put that on the top. We have our lube, we have our syringe, we have our pin, and we have our tape. I'm actually going to prep our tape. We're going to have one small, one large. It's actually pretty long. I'm going to shorten that just a little bit. There we go. Put that to the side, and we're going to have two medium. And your lube can get kind of messy, so I always like to do one extra one just in case. Okay, I'm going to take this long piece and I'm going to split it right here. That will be for when we're securing the tube to you. Okay, so I'm going to put on my gloves here. Now, Mr. Templeton, before we begin, do you have any questions about the procedure? I'm going to wash my hands real quick. No, you understand fully what's going on? Okay, so what I'm going to do is we're going to put these gloves on, wash my hands, and this is a clean procedure, so we don't have to worry about sterility, but we do have to keep things clean. So has your family come and visit you today, Mr. Mike? Oh, they have? And you have a little daughter? That's wonderful. We're going to work on getting you all better here so you can go back to playing with her. Okay, so we're going to take our washcloth and we're going to put it on you to make sure that we don't spill anything we don't really want on you. Okay, we're going to put our emesis basin right here, just in case anything comes out. It's right there, or you feel like you have to cough or anything, it's right here. Okay, so we're going to open up our sterile tube. Okay, perfect. So what I'm going to do first is I'm going to measure it. And how I'm going to do that, Mr. Templeton, is I'm going to go from your nasal passageways to your earlobe. To your xiphoid process, which is in your sternum, which is that. Around right here. Feel for it. Excuse me. So it's about right here. So you have your nasal to your earlobe to your xiphoid process. And I'm going to actually pinch it, and I'm going to tape that with a little tape. Here we have, check it again, nasal to earlobe to xiphoid process. And that's going to work for us. Okay, perfect. So now what I'm going to do is I'm going to take our lube and I'm going to squirt some lube. Okay, Mr. Templeton, so now I'm lubing this right on up, making sure all the little holes are covered, and this will just help it slide down easily. Okay, now, before we begin, again, I'm going to have you start off with your head tilted back, which it is back. When you're inserted in 4 inches, you're going to gag, and I'm going to pull back a little bit, let you recover. You're going to help me out by tilting forward. You're going to take this water, I'm simulating putting this in the patient's hand, and you're going to grab your water up, you're going to take a sip, and then when you take a sip, I'm going to push it in. I'm going to ask you to take another sip, you're going to push it in, and so on until we have it in. This isn't a comfortable procedure, but it should be quick, okay? Alright, so are you ready? We're going to begin. Okay, so here we go. So we're going to insert it in, and insert it in. Oop, gagging. Alright, so I'm going to ask you to tilt your head forward. We're going to pull back and grab your water. You're going to sip, put it in, sip, put it in, sip. Doing a great job. Put it in, sip, put it in, sip, put it in, sip, put it in. Okay, excellent. You can tilt your head back just a little bit. I'm going to put some temporary tape on you right now. I'm going to really try to secure this because we put on quite a bit of lube. Okay, I'm going to take my pen light actually. We're going to look back here. How's everything looking? Everything's looking okay. Okay, wonderful. So now, we're going to take this. We're going to see if we're in your stomach. We're going to pull that out. Make sure that's all out. We're going to see if we can get any stomach contents out. And here we are. Perfect. We're in the stomach. Okay, so what we're going to do is we're going to pull this out. We're going to make sure this doesn't spill everywhere. There we go. How you feeling, Mr. Templeton? Was that so bad? Yeah, it wasn't too bad? Oh, good. Alright, so we're going to take the stomach contents, or what we assume it is. I'm seeing that it's green, so I'm definitely believing that it is. We're going to do our pH test just to double check. So we have our green contents. And doing that. Now I'm comparing it. And we have a pH about 5, so I'm going to say we are in the stomach. Wonderful. Okay. Great job, Mr. Templeton. So what we're going to do is we're going to definitely secure that into place now. So I'm going to take this initial tape off. I'm going to make sure to keep my hand securely on your tube though, so that making sure nothing's moving around. There's a lot of tape by your nose, don't worry. Be careful with that. Okay, perfect. Great job of holding still with me, Mr. Templeton. You're doing wonderful. Okay, and we're going to actually, this tape is going to help us keep it nice and secure on so it doesn't move at all anywhere. I'm going to make sure it doesn't bug your nose at all, or your nares, your nostrils. Make sure it's not too close up, but it's nice and flush. Okay, what I'm doing here is called the figure 8. So it just ensures that we have a nice secure tube that's not going to go anywhere, so we don't have to be afraid of you pulling it out or anything by accident. Okay, so that's nice and secured. It's secure on the tip of your nose. How does that feel? Is it bugging your nostrils at all? No? Okay. Trust me, you're definitely going to be happy that this is in place. We're going to cut that down a little bit. Okay, I'm just securing. I know I'm touching you here, but got to make sure it's all in place. Glad you don't mind. Okay, Mr. Templeton. So now we're going to put you onto suction. So I'm going to start off by turning on. I'm going to turn on our suction. First to continuous. I want it between 60 and 75. So I'm putting it on to continuous. I'm saying right now it's between 60 and 75. And now I'm going to flip it to intermediate. We're going to come over here. We're going to take this. Oh, you know what? Before I do that, I'm going to put this to the side. I'm going to do what is called the whoosh test, just to make sure. I'm going to do between 10 and 20 cc's. Nowadays, this isn't in practice, though, so I realize that. But we're just doing it for this procedure. So I'm going to pull this out, place this in. I'm going to push in some air. I hear some gurgling for our whoosh test in your stomach, so there we go. And I'm going to lift this up, put this down. Now I'm going to grab our suction that I have on intermediate from 60 to 70, between 60 and 75. It's at like 63 now. We're going to attach that on. And normally the stomach contents would be coming out of the patient right now. Our suction thing isn't really working, so we're going to simulate that. Okay, Mr. Templeton, I'm going to secure this to your robe so that you can move around freely again without it coming out at all. Put this on here. I'm going to grab our pin. Which one did I put my pin? Just have my pin. There it is. Okay, Mr. Templeton, I'm going to do another little assessment. How are you feeling? Can you breathe? Can you talk okay? Everything looks good in the back of your throat. Your stomach contents are coming out intermittently. Alright, how are you feeling? Okay, you're handling the procedure alright? Okay, wonderful. Is your nose okay? Everything's looking good there. Excellent. I'm going to actually take this. I'm going to wipe any residual from the lube that we have. Very good. You didn't spit up at all. That's excellent. Have that pinned in. Okay, so now I'm going to take this. I'm going to put these away. Put away. Take these, wrap these up, put them away. So now I would throw these items away, and I would put these items back, take off my gloves. I'll wash my hands. Mr. Templeton, do you have any questions for me today? No? Okay, you're feeling good? You're feeling okay? If you're feeling like you can't breathe, any anxiety or worries, please press this call light and let me know. I will be back to check on you to see how you're doing. So here's your call light. Put this by you. You're going to keep your head of your bed up. Make sure your head of your bed is always above 30 degrees. Okay, so now I'm going to place these items, or put them back, and throw them away. I wash my hands again, step out of the room, and I will document, and I will come back and assess the patient and see how he's handling the procedure. And that's the end of my video.